In this section, we're actually going to be going through how to do rectal ozone insufflation. Rectal ozone insufflation is a really good systemic treatment for the whole body. It's a counterpart to IV ozone therapy. Again, if you're not able to go and get IV ozone, utilizing rectal insufflation at home is incredible. So that is one of the main reasons why we recommend doing rectal ozone insufflation, is for that systemic effect. What we're going to be talking about in this video is ozone therapy, but I want to make a disclaimer first and foremost that this is not an FDA approved therapy. You always want to speak with your physician first before starting any new therapies, and these treatments and these modalities and therapies are not here to treat, cure, or prevent any sort of disease. The information that we're providing today is for educational purposes only. I'm not going to go through the frequency or the specific protocols within this section. All of that's going to be in the link below, so you can get that information down there. So when we're talking about ozone insufflation for rectal use, what we have, again, is we have our generator, we have our oxygen tank, everything is actually hooked up and ready to go. So we have been through that process. The next thing that we're going to need, and we've talked about this as well, is our actual bag and our catheters. So when we're looking at rectal ozone insufflation, typically what we're seeing is we're utilizing the concentration of gamma for this procedure anywhere between 24 and 33 gamma. So if you're actually looking at the chart of your concentration, you can see that we're going to be between 24 and 33, which means we're going to be setting our regulator anywhere between 5 and 7, which is where we're going to turn the dial here once we turn this on. So first and foremost, we're going to grab our bag. Most people, when they use this at home, they think that more is better. I'm going to tell you right now, more is not better. My recommendation always is low and slow, meaning start low on your gamma concentration, slowly build up. There's no need to try to rush this. You have this at home. This is to help build you up, not to tear you down. And if you go too high on your gamma concentration, it can actually affect the inner lining of your gut. So we want to start low on the gamma concentration. Typically, volume-wise, we're going to be starting around 200 mLs. We don't need to fill it up to 750. The most we really recommend anybody doing is up to 400. How you fill this bag is that you're actually going to clamp your fingers. If you're wanting 200 at this top line here, there's a little picture of a clamp there, and also right here if it's going to be 400. For today's example, I'm just going to fill it up to 200. The tubing right here that is actually going to go on the generator, which you're going to input right here, you're going to screw that onto the ozone out port. Again, you have your oxygen going in, the ozone is going to come out. An essential thing to look at and to make sure is that when you have this on, you want to make sure that your clamp is open. After you've filled the bag to the volume that you want, you're going to want to clamp that. And I'm going to demonstrate that here in a moment. So I'm actually going to set the ozone for this at 24. So I'm going to put my regulator at a 5. So once I turn this on, I'm going to move this to the 5. Now we have oxygen going through. The generator is not on, but once I turn that on, so it's just oxygen coming through, generator is now turned on. So now we have ozone coming out into this tube. So as I hold this, you'll notice that the bag is going to start to fill at the top right here. We're clamping this off so it doesn't fill down here, but if you were doing 400, you would come down here. Now you don't want the bag to get super tight. It can actually disrupt the bag. It can break the bag. You can utilize the bag multiple times. So once we get there, you can see it's filling up. You can see from the side. So that is good. What I'm going to do now is I'm going to turn off the generator. I'm going to actually clamp this so that it stops. And I'm going to turn the regulator to 0. So now everything is off. This is clamped. The ozone is now in the ozone bag. So I'm going to remove this. The next step that we're going to do is we're actually going to get the catheter. So we pull the catheter out of our catheter bag. One of the key things that you want to look at this is the catheter has a little black line right here. That is the insertion line. So you want to get it inserted minimally to that line. It's about 3 inches. Now for insertion, you can insert it plain like this. I typically recommend using olive oil, coconut oil, some sort of lube. You can even use ozonated oil so that it goes in more smoothly. Next thing you want to do is you want to actually take the end and screw it onto the end. So now we have the full system. Now, when you're actually doing rectal ozone insufflation, we get a lot of questions of what position should I be in? Get in a position that's actually comfortable for you. So you could be laying down, you could be sitting down, you can be standing up if you want. It really doesn't matter, just make sure that you're comfortable. Another question that we get is, do I need to actually go to the bathroom before I do this? It's not necessary, but we typically recommend that you do so you can actually clean out your bowels before you go. So once this is inserted, you'll actually insert, the bag will come around. What you want to do is unclamp this here, because if you don't, which I've done this before, it's not going anywhere. So unclamp it, this is inserted into you. You're going to then start rolling the bag. So as you roll that bag, the ozone is going to slowly come out of the end. And it is okay right now. I can smell a little bit. Again, we discussed not breathing in ozone. This is a small amount. We're in a well-ventilated area, so we are okay. Once that is out, what I do is I actually clamp this back up. It is empty. I remove this. And the big question that we get is, how long do we have to actually hold this in? Ozone reacts almost instantly. So my recommendation is trying to hold it in anywhere between 10 to 20 seconds, 30 seconds if you can. It is okay if you pass gas doing rectal ozone insufflation. Again, because that ozone is reacting so fast, it's actually getting through that biome and getting into your body systemically and doing what it needs to do. So don't worry about that. You haven't defeated the purpose of actually doing rectal ozone insufflation if you're passing gas.